Assalamualaikum to everyone. My name is Tengku Zuma Batrisha binti Tengku Samsu Arif.
My name is Muhammad Nazir bin Karudin.
So, my name is Muhammad Ufi bin Azmi Murad. I'm from SR113 Class D2.
My name is Hafiz Iskandar bin Ashirazi.
Hi, my name is Siti Aminah binti Abdul Hadi. This video is for our assignment SPS135 Introduction to Kiniesiology.
So today, me and my friend going to talk about the cardiovascular system. So what is cardiovascular system? Cardiovascular system, also called the circulatory system, is the organ system that transport material to and from all the cells of the body. The materials carried by the cardiovascular system include oxygen from the lungs, nutrient from digestion system, hormones from glands of the endocrine system, and waste material from the cells throughout the body. Transport of these and many other materials is necessary to maintain hemostasis of the body. The main component of the cardiovascular system are the heart, blood vessel, and blood.
So, I'm gonna explain about the structure anatomy of the cardiovascular system. So, the main component of the cardiovascular system is heart, blood vessel, and blood itself. Then, function and location of the heart. The heart's job is to pump blood around the body. The heart is located in between the two lungs. It left on the middle of the chest. Then, the structure of the heart. The shape of the heart is size of face, roughly cone shape, and the length is about 20 cm long, 9 cm across the borders point, and about 6 cm thick. Wall of the heart is made of divide of the epicardium, myocardium, and endocardium. The epicardium is the visceral layer of the serous pericardium. The myocardium is the muscular part of the heart that consists of contractile cardiac muscle and non-contractile fibers that conduct nerve impulse. Cardiac cells are in this area. The endocardium is the thin, smooth endothelial inner lining of the heart, which is continuous with the inner lining of the blood vessel. So, the chamber of the heart divided to 4 parts. They are upper and the lower. Upper chamber is its name is atrium. It's divided to left and right. So the left one is receive blood from the lung, and the right receive blood from the rest of the body. So for the bottom ventricle is named ventricle. Right ventricle is pump blood to the lungs, and the left ventricle is pump out blood to the rest of the body. So blood vessel is divided to 3: arteries, veins, capillaries. Arteries. Oxygenated blood enter the systematic circulation when leaving the left ventricle through the aortic semilunar valve. The first part of systematic circulation is the aorta, a massive and thick walled artery. So capillaries. Capillaries is arteries branch into a small pressures called arterioles and then into the capillaries. The capillaries must to bring blood into the venous system. Veins is the explanation is capillaries must merge into venous, which merge into veins. The venous system fits into the two major veins, the superior vena cava, which mainly drains tissue above the heart, and the inferior vena cava, which mainly drains tissue below the heart. These two large veins empty into the right atrium of the heart. So valve is the heart consists of 4 chambers: 2 atria upper chambers and 2 ventricle lower chambers. So heart valve is divided 4 tricuspid valve, pulmonary valve, mitral valve, aortic valve. The pulmonary valve is located between the right ventricle and the pulmonary artery. Aortic valve located between the left ventricle and the aorta. Tricuspid valve located between the right atrium and the right ventricle. Mitral valve located between the left atrium and the left ventricle.
So, I'm going to talk about function of cardiovascular system. Main function of cardiovascular system is to maintain blood flow to all parts of body. First, to deliver oxygen and nutrients. Blood circulates through a network of vessels throughout the body to provide individual cells with oxygen and nutrients. The heart pumps the blood around the blood vessels. Second is to remove the waste product like carbon dioxide and waste products of metabolism to the excretory organs for disposal. Third is to maintain body temperature. Thermoregulation and the nervous system plays an integral part. Thermoregulation is a process that allows your body to maintain its core internal temperature. It also helps you to prevent dehydration. You need to drink enough water to avoid hydration. Dehydration can cause various effects like dizziness. So you need to stay hydrated because it has a lot of benefits. Lastly, it can prevent infection. White blood cells protect body to defend the body against foreign microbes and toxins. Clotting mechanisms are also present that protects body from blood loss after injuries.
The reason I made this video is to continue what my friends talk about the cardiovascular system. Okay, or to be specific, what I'm going to talk about is about the blood flow in cardiovascular system. So before we get to the main point of this video, I'm going to talk a little bit about the blood. Okay, what is the blood? What is blood actually means? It is a body fluid in humans and other animals that deliver necessary substances and transport metabolic waste product away. Okay, and of course you can see on my slide, the blood is really essential for our life, and it has four main components: plasma, red blood cell, white blood cell, and platelets. Now we move on. Okay, next we're going to talk about the function of the blood. Okay, the first one, as you can see, the blood will become a transportation for cells, nutrients, oxygen, and carbon dioxide. The second function of blood is stabilize the temperature and pH inside our body. Okay. The third one is carrying cells and antibodies that will fight disease in our body. And the last one is to bring in the waste product away. Now we are going to talk about the main point of this video, and it is about the blood flow in cardiovascular system. So what is the essential components for our blood flow? Okay, the first one is the heart. Second one is blood. Third is blood vessel. Fourth is pulmonary circulation. And the last one is systemic circulation. Okay, now we're going to talk about the blood flow inside our body. So the first one, we're going to talk about the right side of our heart. The first step that we will do is the blood will enter the heart through two large veins. It is the inferior and the superior vena cava. They will empty in the oxygen-poor blood from body into the right atrium. Okay. Next, blood will flow from right atrium into right ventricle. The blood will flow through the open tricuspid valve. When the ventricle is full, the tricuspid valve will shut. This happens to prevent blood from flowing backward into the atria. The last one for our right side is the blood will leave the heart through the pulmonic valve into the pulmonary artery and the lungs, where it will be oxygenated. Now, we're going to talk about the left side of our heart. The first one that we'll do is the pulmonary veins empties oxygen-rich blood from lungs into left atrium. Next, the blood flows from left atrium into left ventricle through the open mitral valve. When the ventricle is full, the mitral valve will shut. This happens exactly the same as the right side, because it will prevent blood from flowing backward into atrium. Last one, the blood will leave the heart through the aortic valve into aorta and to the body. This two-sided process will keep repeating over and over again. Okay, as you can see on my slide right now, I show you how our heart structure looks like.
Today, I will talk about two abnormal conditions of heart. Number one is heart failure, and number two is coronary artery disease. Heart failure most often result is from the weakening of a heart muscle. It is when the heart fails to pump enough blood to supply oxygen and nutrient the body needs. Symptom of the heart failure is cough, breathlessness, fatigue, swelling of the abdomen, legs and feet. Common cause of heart failure is previous heart attack, coronary artery disease, high blood pressure, diabetes, excessive alcohol use, and inherited heart condition, cardiomyopathy. Treatment of a heart failure may include medication, lifestyle changes, device transplantation, or surgery. Coronary artery disease is the most common type of a heart disease. Sometimes it will be called coronary heart disease. Coronary artery disease is caused by a plaque built up in the walls of the arteries that supply blood to the heart. It called coronary arteries. Plaque is made up of deposit of the cholesterol and other substances in the artery. A symptom of the coronary artery disease is extreme weakness, chest pain, and a faster than a normal heartbeat. Risk factor for coronary artery disease is smoking or breathing secondhand smoke, being obese or overweight, and have high blood pressure and high cholesterol. Treatment of coronary artery disease may include medication, lifestyle changes, and surgical procedures to help restore blood flow to the heart.
Okay, the conclusion for my topic is the human heart is a four-chamber muscular organ, shape and size roughly a man closed fist with two-thirds of the mass to the left of the midline. The heart is enclosed in a pericardial sac that is lined with a parietal layers of a viral tissue. Alright, that's all.
My conclusion about this topic is we need to take good care of our cardiovascular system because we need to use it for a long time.
Conclusion from my part is I got to know about what is abnormal heart condition, symptom of abnormal heart condition, risk factor of abnormal heart condition, and treating abnormal heart condition.
In conclusion, we all know that our heart already has
its natural blood flow, so we as a human being, we should take care of it from being damaged so it will stay healthy as it should.
And that is all from us. Bye. Thank you for watching.